A potential lifeline for Hennepin County Medical Center. Tomorrow morning, a bill is expected to be introduced that proposes raising the county sales tax by 1%, with funds going toward helping HCMC. It's getting mixed reviews from lawmakers, but hospital leaders say without help, the hospital could start to close by June. Jennifer Hoff joins us now with what people can expect if, in fact, it does happen. Jennifer?
Julie, people in Pennsylvania know that all too well when 5 major hospitals there closed within 6 years, some very similar to HCMC in size and the people they serve. A safety net for those who often can't pay or access care anywhere else. And while it forced other systems to be more efficient, the aftermath was quite chaotic and highlighted systemic issues in healthcare financing.
Hennepin County Medical Center has a long history in Minneapolis, now facing unprecedented financial struggles. A lot like Crozer Chester Medical Center that closed a year ago, some 20 miles outside of Philadelphia, shocking even longtime nurse Peggy Malone.
Nobody is going to take this from us and this community.
Part of the protest there to try to keep it open.
And we really believed that it couldn't be possible.
The for-profit hospital was one of 4 in that system that went bankrupt, putting nearly 3,000 people out of work, including Peggy.
You take away their health care, but you also take away their ability to have employment.
Today, there are just 400 beds for 700,000 people living in that county, some of whom would go to nearby Riddle Hospital, pushing its emergency room patient visits up by 40 every day.
You don't have the space for it, you don't have the staff for it, you're not equipped for it. So patients experience a much greater weight.
The president says hospitals have to invest in more outpatient services, more favorably reimbursed, like mammograms and MRIs, and cut even more costs.
So instead of being in an actual room, a hallway bed. We've switched as well, and we have patients now in recliners.
What's worse, in Philadelphia, its oldest and largest safety net hospital had also closed in 2019. Like Crozer, Hahnemann Hospital was privately owned and went bankrupt. Unlike HCMC, nearly entirely funded by insurance reimbursements, public programs the feds are changing next year as the cost of uncompensated care skyrockets. The hospital now staring down $2 billion in losses in the next decade. Its chair hopeful lawmakers pass a 1% Hennepin County sales tax to keep it from closing.
We've got leadership on both sides. We've got people who care deeply about the hospital statewide, and that's a good thing.
So this new bill will get its first hearing in the Taxes Committee on Thursday, but its chair tells me expect a lot of amendments. As for those Pennsylvania hospitals, Hahnemann still sits empty and will likely turn into apartments, while a new developer just bought Crozer with plans, Julie, to turn it into a much smaller hospital. And several of the nurses I spoke to who used to work at the old Crozer say they are more than willing to go back and work there if it in fact does reopen as a hospital.
I mean, it's hard to imagine the state's busiest emergency room closing if HCMC closes. It also is a level 1 trauma center. But even with that bill, my understanding, Jennifer, is that that's even just a short-term fix. Is that true?
There's folks out in the community have said this is in fact a Band-Aid. It is a short-term fix, but it's what they need now to fill the holes. That when we look ahead in the next decade and all of these changes that are coming to Medicaid, you're going to be looking at even larger deficits. So every hospital across the country is going to face a lot of problems, and they better be working on solutions right now.
All right. Thank you, Jennifer.